Hi, my name is Dr. Mayank Singh. I'm basically a plastic surgeon and a diplomat of American Board of Hair Restoration Surgery. I'm currently the Honorary Secretary of AHRS India. Today I'm going to take this opportunity to help you identify how to choose a hair transplant surgeon so that you go onto the right track for your first surgery itself. Hair transplant, being an aesthetic procedure, has seen an upcoming rise of new clinics which have come up over a period of time. When we are choosing this procedure, you have a specific amount of donor in the back of your head as well as some amount of body donor reserve. That reserve is something which is a key element which is going to be sustainable for the rest of your life. The maintenance of this donor recipient ratio would be based upon the planning of your first procedure itself. If your donor has been over harvested in the first session and you do not get a good result done at any clinic, in that case, it's very difficult for a hair transplant surgeon to rectify your result and give you a good illusion of having a head full of hair for all the years to come. Hence, we would talk about how we should go about choosing which center is the ideal center or the surgeon where we should be going and performing our surgery. The first and foremost is the qualification of the surgeon. So, as per the AHRS guidelines which have been given, there are 5 specialties which have been included to be qualified enough to perform hair restoration surgery. First is a plastic surgery qualification, which can be an MCH or a DNB. Second is a dermatologist, which can be an MD or a DBD degree. Apart from that, a general surgeon or an ENT surgeon, as well as a diplomat of American Board of Hair Restoration Surgery. So these are the 5 criteria which have been laid down, which would tell you that the surgeon is adequately qualified to perform your hair restoration surgery. Qualification is only a base. None of the residents are being taught, most of the colleges in fact, there is no hair transplant training which is being given during residencies. There are some colleges, I agree, where they are taking care of hair transplant surgeries during the residency phase of dermatology as well as plastic surgery in various colleges. But most of the colleges, this is not being implemented. So we have to be sure about the kind of training an individual has after he or she has passed out of the residency programs to be adequately trained with hands-on training under the supervision of someone who's experienced as a hair transplant surgeon. So first is the qualification, second is the training of that individual. Hair transplant is a team effort, so it's never a one-man show. Whenever we are talking about the team that is going to help you, there are certain steps which have been laid down by the ISHRS as well as the AHRS, where they say that the guidelines given for the role of the surgeon has to be followed in the following manner. So the steps that the surgeon has to do himself or herself are: first, FUT, if it is being performed, then FUT extraction and FUT stitching of the back of the scalp. FUE scoring and punching of each individual follicular unit needs to be done by the surgeon himself or herself. The slit making, if someone is using a pre-made slit for placing the follicles, in that case the slit making incisions being made on the recipient area also need to be performed by the surgeon himself or herself. Implanting as well as slivering or dissecting of the follicular units or trimming them and making them refined to be placed into the units can be done by the technical staff. If someone is using a stick and place technique where you make the slit and you simultaneously implant the follicular unit, in those cases the surgeon himself or herself has to do the slit making as well as the implanting. Apart from this, if someone is using implanter pens, then implanter pens can be placed in 2 manners. One can be a stick and place where you are doing with a single shot of slit making and implanting of the follicle. That has to be done by the surgeon himself or herself. But if someone is using pre-made slits with blunt implanter pens to place these follicle units inside, then the slit making can be done by the surgeon, but the implanter pens can be used by the technicians. Apart from this, we have to know that what are the experiences of the surgeon performing hair transplant surgery. Now, Anyone who's qualified and trained will not be experienced on the first day itself. It is up to us how we choose a person's experience and caliber to deliver results. So someone will start with a surgery afresh. No one will have done 400 or 800 surgeries on the first day of his or her practice. But still, knowing these guidelines and knowing about the experience of the person will make it kind of a surety that someone has delivered results over a span of years. Apart from that, the team which the surgeon is holding with him or her, whether it is a full-time team or it is a per case basis that they are calling in freelancing kind of technicians to come in and perform their surgeries. So if it is a full-time team, then it is a much better option because of the fact that the surgeon will know which technician is supposed to be deputed or delegated for which role and who is good at what task. So it will be always much easier for a surgeon to monitor and deliver quality of the services that are being done by the team. Apart from that, when you go to the surgeon, you have to have a personal rapport with the individual. If you feel comfortable, if you feel that there is transparency of whatever dialect you're having with the surgeon, and you feel that the person is good enough to go ahead in terms of the personal rapport that you have built with him or her, then it is definitely going to be much more comfortable for you because it is a prolonged procedure, which it is going to be like around a 6 to 8 hours procedure on an average. So practically, these are the things which is going to give you an insight into what exactly needs to be looked for. Apart from this, whenever you are visiting a center, always check the number of procedures that are being done on an average in a month, or what are the total number of surgeries that have been performed over a span of years of practice. Whenever we are looking at results, always look at the naturalness of the results as well, not just the hair growth and the density that has been given. What I tell my patients is that you should always look at least 50 to 100 results of all the patients that are being shown to you from different angles against the same lighting, same background, so that you can compare and see what was the kind of delivery of results given by the center. Apart from that, you should at least take 20 to 50 numbers, whatever the center and you wish to have. Talk to those patients, what was the kind of experience of those patients with these respective centers or the surgeons, and what were the kind of results, what was the kind of follow-up done, what was the kind of sequels post-surgery, how comfortable was it as a procedure, what was the kind of comfort levels over a period of time, how was the result, what is the follow-up period, how long has been the surgery result on the head of the patients individually. So all these things would give you an insight of what exactly is coming up. It is not just about what the surgeon is telling you, it is also about what the patients who have undergone the procedures with those surgeons are telling you. I always tell my patients that at least go and meet 4 to 5 patients. If you have come via a reference of someone who's been operated, you've already seen and met and talked about it. But if you are looking at sources online and then going and meeting the surgeon, it's always better to identify at least 4 or 5 good patients who are comfortable meeting you. The center is comfortable, the surgeon is comfortable giving you those numbers and details. Then go talk to those patients, meet them in person, see the results in person, see the donor area, see the recipient area. All these things will give you a fair idea about what kind of quality of work is being done by that surgeon or the center. So to summarize, what we need to follow is the qualification of the person, the training of the person, the experience of the person, the team of the center, whether it's a full-time or a part-time team, what are the kind of results delivered, how comfortable you are with the surgeon, and apart from this, what exactly is the feedback of the patients who have undergone surgeries with the center. Once you have all these things in place, it's most likely that you have taken care of all the factors which are going to make sure that your results should fall in place. I hope I have answered most of the things which you would have wanted. If you have any further queries, you can place them in the comments below and we'll take it from there. Thank you so much.